Now, late perimenopause is that stage right before you hit menopause. And late perimenopause, usually that's when your cycle starts to change. You start noticing shortening of your cycle and then lengthening of your cycle because now estrogen is involved. And estrogen is what thickens the uterus, right? And progesterone kind of says, pause, this is good enough. And so when you have this sort of change in estrogen and it's getting lower, then you start noticing you're not getting your period. It's starting to space out. And when this starts to happen, you also start experiencing symptoms of low estrogen. And those can include hot flashes, night sweats, like just feeling hot, like you just want to take your covers off at night, vaginal dryness, recurrent UTIs, vaginal infections, skin changes. You start noticing wrinkles and start noticing changes in your skin. You start having symptoms of brain fog or, why did I go in this room? What happened when what was that kid's name in high school? I know. So you start noticing the estrogen's effect because estrogen's starting to decline and get low enough that eventually both estrogen and progesterone are low enough and you don't get a period at all. And that is officially menopause. So why this matters is because if you're starting to be in late perimenopause, you may benefit from estrogen because your estrogen is low. So it matters which stage that you are in because you wouldn't want to start somebody on estrogen and progesterone right away and they just started experiencing perimenopause because they might actually have symptoms related to too much estrogen. So it's important that you know what stage, early versus late. I will say that one thing you can do is start tracking your cycles, start making sure you write down the symptoms that you're having specifically. And if you do get hormone testing, please make sure that you're getting hormone testing on specific days of the cycle. And make sure that you are seeing a provider who knows how to interpret those specific days of your cycle. Because it doesn't do you any good if you're getting a random estrogen and progesterone level and you don't have it coordinated with a certain day to know what is actually normal. Because if you look at this menstrual cycle graph right here, you can see there's a big difference between your estradiol in day 4 or 5 versus day 26. And certainly on day 10 to 12, you can see it goes up. And so you have to know which day of the cycle when you get your blood work. So those are the symptoms of early versus late. So let's just recap. So you might be in early perimenopause if you're experiencing can't get to sleep, can't stay asleep, agitation, anxiety, but regular cycles. You might be in late perimenopause if you're experiencing, hot flashes, night sweats, vaginal issues, cycles that are changing and getting more spaced out. You're not too young. You're not imagining. This is probably your hormones. And the more you know, the more empowered you are, the more you can get the care that you need to thrive now and in the future.